Brought to you by GTA, your island, your network.
The numbers are often alarming. On Guam, more than 260 people between the ages of 3 and 21 that are in the public school system have autism. Dr. Hunter Duenas testifying that before senators during the hearing on Bill 16 today, the measure would mandate the provision of health care insurance coverage for autism spectrum disorders by insurers. Senator Dennis Rodriguez Jr. is the bill's author, known as Hunter's Law of 2017, a measure that comes as efforts move ahead to develop the island's first autism center.
The purpose of that is to ensure that we are able to provide services and treatment that are not available now to families with ASD.
The bill getting major support from parents who know all too well about the endless medical trips and mounting costs it takes to care for a loved one with autism.
I think this is just another option that we parents will have.
At least one healthcare provider, Select Care, offered its support in the efforts to expand coverage for ASD, but also emphasized the fact that any additional benefits will, quote, correlate with increased medical insurance rates.
Despite the high occurrence of ASD here on Guam and nationally, do you think that this is a reasonable cost for coverage to set a baseline of coverage?
The recommended treatment for autism, again, is 25 to 40 hours of behavioral therapy per week. The $50,000 cap proposed in this bill only pays for about 10 hours of therapy a week. And I know it does affect our companies here. We are also open to working with insurance companies to come up with a reasonable solution.
While the discussion rolls on before the measure makes it to the session floor, the little man the bill is named after didn't leave without giving his input as well.
Hi, my name is Hunter Duenas. I write these rules. I have autism. Please vote. Please bill. Thank you.
Brought to you by GTA, your island, your network.